Welcome to HCA Talks Health. I'm Zina Leroux, and with me today is Kristi Adams. So, Kristi is an accredited coach and a trainer specializing in healthcare leadership, and she's the lead tutor and the coach at the NHS Leadership for Personalised Care Programme. And she's part of so many different initiatives, and she'll tell us more about all of that just now. So, a very warm welcome to you, Kristi.
Thank you. Lovely to be here. Thanks for having me.
So I think I want to, before we go into all the different initiatives that you're part of and the areas that you work in as a coach and a trainer, I think I want to start with your own story. So I know that you suffered from chronic fatigue syndrome and that it's kind of part of why you're doing what you're doing today. So yeah, would you mind sharing a bit of your story with us to start out with?
Yeah, of course I will. Yeah, thanks. I mean, we all have a story and we all have a journey and we all have reasons, don't we, why we end up doing what we do.
Yes.
So I think mine goes back to when I was 7. My parents got divorced, and so I was living with my mum during the week and I was seeing my dad on weekends. And my dad got diagnosed with a pituitary gland tumor, which is a brain tumor. And many people have them and they live well with them. But my dad had lots of complications, not just physically, but kind of mentally and emotionally associated with it as well. So I kind of found myself in this really odd world where I was living this normal life with my mum and my sister during the week. And then I was a young carer for my dad, Larry, on the weekends. And it was really scary and probably very unsafe, looking back on it now. And I was either kind of with him at home looking after him, or a lot of the time he ended up being in hospital. So most people really hate the smell of hospital food. I don't. I love it because it takes me back now to being reminded that actually when Dad was in hospital, my sister and I were safe and not having to look after him. Yeah. Anyway, he was quite a challenging person to be around, but I learned a huge amount from him. He was incredibly tenacious, and so one of the dreams that he had was to see me graduate. And by then he'd had both his legs amputated. He was a double amputee, just below the knee. So his dream was to stand on 2 prosthetic legs and have a picture taken with me when I graduated, and he did. Oh. Yeah, it was amazing. Yeah, he did really well. And, that's what he lived for. And he died a couple of months later. And I guess I just learned a huge amount from it. But what I learned more than anything is, well, 2 things really. The first is just how incredible our health service is and how important health is. And secondly, we are amazing human beings, aren't we? We have this ability to dig deep and to be tenacious and to redefine ourselves. And so my love and my belonging in healthcare, I ended up specializing as a coach in healthcare, and there's a big bit in between, which I'm very happy to tell you about if you want to hear it.
Please, I would love to. Yes, tell me more about it.
So after I graduated, I decided to study social policy, and I specialised in healthcare. And when I left university, I worked within healthcare at quite a few of the national bodies and regulators like NHS England, the Care Quality Commission. Before it was the Care Quality Commission, I worked at the Human Tissue Authority, the Royal College of GPs, and I just loved it. I absolutely loved it, and particularly loved working with doctors and nurses kind of, frontline. And then in 2009, I had my first daughter, and then 17 months later, I had my second daughter, and I just wasn't well. And I was really scared because Dad had died when I was 21. He was quite young, and I was having a lot of the symptoms and things that he was having. And so I just thought, well, that's it. I'm done. That's probably the path I'm going to follow. And it was really scary, actually, really scary. And when the kids were 2 and 3, I I ended up being bedridden for a year. I was very, very unwell. I didn't know what was wrong with me. Nobody knew what was wrong with me. I just completely ducked out of life. So I had this growing career in healthcare. I'd been a young carer in healthcare, and suddenly I was a patient, a very unwell patient in healthcare. And yeah, I just retreated from life for a long time, and I ended up being diagnosed with chronic fatigue, ME, chronic fatigue syndrome, and I just had to restart my life. And I found coaching.
Yes, so you had to restart your life. And did you see a coach first, or did you just read about coaching? How did it start?
Yeah, it's a really good question because I'm not sure I can pinpoint exactly how and when it started. But what I realized was all my life I had a belief that we have an inner resource and that we have way more strength and capacity than we ever realize. And I think that I learned a lot from Dad.
Mm.
And so I started to think, well, there must be a way out of this. This can't be it. And so I realized that I was also really curious. And all my life I've asked questions
Mm.
and I've wanted to understand humans and human behavior. So I think I started to think, well, what is that? What does that actually mean in real life? And so I think I just found, on Google, this thing about coaching that I'd never heard of before. And as soon as I saw the definition of coaching and the power that it has, I realized that two things. One is what I needed to become well and to restart my life. And two, I needed to take this thing called coaching into healthcare because so many people working in healthcare could really do with that. So yeah, started to study coaching, and during the process of studying it, had coaching, and then decided to leave the world of paid employment, which was terrifying, and start up a coaching and development organization back in 2015. So yeah, I was very unwell, and in a very weird way, it was probably the best thing that ever happened to me.
So I've got so many questions coming up around all of this, but the first one is, so you wanted to become well. So what were some of the first steps that you took for yourself?
Yeah, it's such a good question, isn't it? Because it's not until we are asked these sorts of questions that we reflect back.
Yeah.
The first thing I had to do, if I'm honest, was accept where I was at.
Mm.
Because I think for a long time I just tried to pretend that I was well.
Yeah.
I was so cross with myself because I couldn't be around for my babies in the way I wanted to, my toddlers. Um, and I was fighting it and fighting it. And then I just think I remember lying in bed one day, I remember it so clearly, and my husband had gone to work, he'd taken the kids to nursery, and there was a glass of water over the other side of my bedroom. And I needed it. I was so thirsty, and I just couldn't get up and get this water all day. And I remember thinking, I have to find a way out of this. I cannot live my life like this, because I had no life. And I think that moment lying in bed, I thought, right, okay, I'm not going to fight this anymore. I'm just going to lean into it and accept it and find out what I need to know about it and me to get myself through it. So I then reached out for help. I was then able to say to people, look, I've been hiding this for a long time. I'm really not very well. And people were so relieved because they said, yes, you'd shut us out and now you're letting us in. I had cognitive behavioral therapy. I was in the world of coaching by then, so I was having lots of coaching. And I found yoga, and I found self-acceptance.
Mm. Yeah, so I mean, acceptance, that first step, but also reaching out, getting that support from people around you and engaging in behaviors that make you feel well. They're also important. So, do you believe, just thinking about everything that you told me just now, do you believe that our experiences can also impact our health?
100%. So have you read The Body Keeps the Score?
Yes, I
Yeah,
have. Bessel
yeah.
van
I
der
mean,
Kolk.
it's just an incredible
Mm,
book, because essentially it tells us that, you know, we are impacted by trauma in ways that we just probably don't ever think about. So I, in many ways, I was a very fortunate child. I was very loved. I wasn't in a war-torn country. I wasn't living in poverty, but arguably I probably did have some trauma because I was a young carer and spent a lot of time in hospitals around very ill people. My dad himself was very ill. It wasn't very stable, and I couldn't live a normal childhood because
mm,
I had that burden of responsibility. So whether I or others would call that trauma, I'm not sure, but it was traumatic. And
mm,
so absolutely, I know that when I started to look into ME, chronic fatigue syndrome, essentially it was my body's way of dealing with that unprocessed trauma. And the body and the mind are so inextricably linked,
mm.
aren't they? So
Absolutely.
I, overwhelm and anxiety and all those things, they come out in the body. And for me, the chronic fatigue syndrome was actually physically the result of undiagnosed glandular fever when I was younger. So quite a few people that have glandular fever end up with this post-viral fatigue,
Mm,
of which ME, chronic fatigue, is. So I had the virus in me. My body was very physically affected by it because I've got various autoimmune conditions as well. But absolutely, in answer to your question,
mm,
the mind and the body are so linked, and the whole system just shut down.
mm. And I think very interesting is the link between certain experiences and pain. And often I think people think that because of that, because it's an emotional reaction, or because there's no physical cause to the pain, that maybe it's not real. But it is. And as you said, and we can read in many of these books, there's um, the body bears the burden and keeps the score, right, of the experiences that we've had over time. And I don't have the stats with me right now. Maybe you have, but I've seen some info on people with adverse childhood experiences, if they've got a high ACE score, as they call it, where their chances, or the pain that they experience with something such as fibromyalgia, or their chance to get fibromyalgia or even chronic fatigue syndrome is that much higher. Have you seen those stats or not?
I don't know
Yeah,
them off the top of my head, but I mean, I am one of those stats, and that I lived it and I breathed it. And I just think that there's a denial that we have in ourselves because we
mm,
we just don't want to admit that we're failing.
mm,
Um, and I think the first step is knowing that it's not something we've done or haven't done. It's our incredible body's reaction to, what we've experienced.
exactly. Yeah, there's almost like a message from the body. It's a wanting you to do something, or wanting you to at least process what has happened to you, which I think there's lots of inner wisdom in all of that. So if you had the opportunity to tell your younger self one thing while you were in that situation, what would it be?
Yeah, I mean, I've thought about this on many occasions, and I'm not sure if I've articulated it before.
Yeah.
So it's nice to be asked the question, actually, because I have two teenage daughters,
Mm,
and it's important, isn't it, to reflect back on our own lives in order to share some of our wisdom with them. I think we are all far more capable than we ever imagine, and often it's not until we're put to the test that we ever really realize that. So I would say to myself now, firstly, this is the best thing that's ever happened to you, which if anyone had have said that to me at the time, it would have been very well received. But, you know, it changed my life path, and it taught me about the fragility of life, how precious it is, and it's placed me into an absolute state of gratitude. I live in a state of gratitude. So I would say it's the best thing that ever happened to you. You have got the mental strength and the tenacity and the curiosity to find your way through this. And you will, and you will.
Love that. And I think, as you mentioned earlier, this is something that helped you to become really passionate about health, healthcare, and specifically taking health coaching into the healthcare system. So tell us a little bit more about that. So you started out a while back where you said, okay, you quit your job and you started your own business. How did that go? How did the first few months go for you? What was it like?
It was terrifying. It was absolutely terrifying. I'd only ever been in paid employment, you know, really secure paid employment in the health service, in the NHS, where you get fantastic pension and benefits and support. And that was all I'd ever known. And it was all I could ever see. I was climbing this career trajectory. And I mean, I don't know where I would be now, but I had hopes and dreams and ambitions. And then, yeah, I almost kind of crashed out of it, really. And it was completely terrifying. There were two things that I did that now that I think probably really were the foundation. So the first one is I just set up a company and I gave it a name, which was Atigo, which means achieve in Latin. And that was the first thing I did. And I thought, well, wherever this goes, I need a company. I mean, I have no idea. I had no idea about business or anything like that. So I set that up, and that felt right. You know, I just knew that was the company name, and I had a vague idea that I would be taking coaching into the world of healthcare. And the second thing I did was contacted the 5 people in my life that had been the most inspirational or the most supportive, or, you know, like my champions or my cheerleaders. So the 5 key people across my whole career, by which point that was over 15 years. And I just said to them, hey, hi, you know, some of them maybe knew I'd been unwell because I ducked out of the world for a few years. Hi, you know, this may seem really random. It is quite random. I've left the world of paid employment. I don't know what I'm going to do. I've set up this company called Atigo. I think I want to take coaching into healthcare, but I have no idea how. And I'm just saying it out loud because you're somebody that over the years I've felt comfortable or safe or trusted with. And those 5 people have generated and sustained my business for 9 years because it was great timing. They happened to be able to say to me, look, actually, we've got this opening. Could you come and, you know, be involved in it? Or we created something together. And since then, they've connected me with someone and they've connected me with someone. And that's the way the world works. So, yeah, the certainty of knowing Atigo and the trust in those 5 people, I guess the universe was just being very kind to me.
It's amazing how when you just say something out loud, you never know. You never know. And I found the same thing with some of the clients that I've worked with before. You know, if I mean, all clients you treat equally well, hopefully, but you never know what that might lead to, what connections they may have, or, you know, how connected they are. So that's exactly the thing, like just saying it out loud, putting your dream out there. And then it worked out quite well for you. So tell us a little bit more about where you are at now. So what are the different initiatives that you are part of currently?
Yeah. So there are various different initiatives, and I'll keep it as simple as I can. perhaps you know that in the world of coaching and training and behavior change, there's often lots of different things going on. So the key thing, I guess, is that I have an organization called Atigo Coaching and Development, and it's been going since 2015. And there are different strands to that. One is that I provide private life health coaching to people if they want it, they come to me, and that's not necessarily through the world of healthcare. I also provide one-to-one coaching for people working in the National Health Service and health-related charities. Excuse me, I just need to blow my nose.
Go for it.
Here we go. It's cold here today. And in addition to doing the one-to-one coaching, either privately or because I've been commissioned within the NHS or a charity to do it, I also do various different forms of training around behavior change. I'm really reluctant, you can probably tell. I'm not very good at using words like coaching and training because I don't think they describe very well. And I think a lot of people say to me, what is coaching? And essentially it's about creating a safe, confidential space, isn't it, for people to explore their challenges, their issues, to find their ways forward, and whether that's at work or home, be the best version of themselves. And actually often people are paid, I'm paid by the NHS to coach them because it's work related, but we're a whole person, aren't we? So we don't just separate ourselves out. So people bring what they bring, and then the training is around leadership and management, creating psychological safety. How do you motivate people, bring out the best in them? How do you have really difficult conversations? How do you manage yourself and your being and your time? And how do you create resilience within yourself and perhaps within your team? And then I train people to become qualified coaches as well, with an organisation called the Coaching Academy. So I run their leadership module, which is part of the corporate and executive coaching diploma. I also, and I smile at this because it's something that brings me so much joy, I train doctors and nurses and their teams to run group clinics for patients. So normally you go to your doctor and you see them, don't you? And you just see them one-to-one. But again, this links back to the chronic fatigue ME, because I was so ill in bed. I needed help, but I couldn't physically move. And if someone had have just put a laptop on me and said, click this button, Kristi, and you can be connected to 6 or 10 other people who are in bed like you, going through something very similar, my world would have changed.
Imagine. Yeah.
Imagine. So that's what I do. I work with doctors and nurses and their teams to provide support for them so that they can see their patients in groups, either face-to-face or online. And that's usually patients with like diabetes, asthma, etc. And it changes patients' lives and it changes the lives of the practitioners as well.
I love that. So quite a few different things that you're part of. So, I mean, you've been in the world of coaching now for, what is it? How many years? 15?
I've been in the world of coaching for 9 years, but I've always been a coach. I think as a manager, I still see people that I used to manage and they say, well, of course, you were always a coach. And I think, well, I didn't know what that was. But I've been a professional coach and a neurolinguistic programming practitioner and various other things for 9 years.
And do you think you're still as passionate about coaching as you were when you started out?
I mean, more so. It's not just a profession or something that I do. It's how I am. So, I also coach a girls' football team, teenage girls, I know.
Wow.
And I don't know a huge amount about football. I know enough. But what I do is spend time listening to them, asking them questions, helping them bring out the best in themselves. So it's not just a what I do 9 till 5. It's so much more than that. I coach myself through life. I coach other people through life. It's how I am. It runs through my veins, and I think more and more and more that everybody deserves somebody to be alongside them and to champion and to challenge them.
Yeah. So I think you've mentioned quite a few things now, but what do you find is the most powerful thing about coaching? Why is it that you love it so much?
I mean, what a privilege, isn't it, to have that window into people's lives, and people tell us things that they have never told anyone and probably would never tell anyone else, or they realize things about themselves that they've had jumbled in their mind for years, and then they have this safe space to express that. I don't think there's a better job. I can't imagine doing anything else. It's hard. It's a really tough job because, day in, day out, you're hearing people's stuff, and it's deep, and it's real life stuff, isn't it? It's not surface stuff. So I can't imagine doing or being any other way. And I just wish that it was more widely understood, because we have personal trainers for our bodies, don't we?
Yeah.
Everybody knows what a personal trainer for their
Yeah.
body is. And even people that don't have a huge amount of, spendable income might spend it on that. But we don't talk about personal trainers for our minds, and I guess that's what we are. And I don't know that that is valued as it should be or could be.
But it is quite, I would say, a privilege to be allowed into that space that you've just shared with us. So when a client discusses what's going on in their lives and their breakthroughs, it's quite a fulfilling job, right? Yeah.
Well, somebody just this morning was talking about how they're in a new role and they just feel like an absolute fraud. And it was so visceral as she was describing herself as a fraud and, as a fraudster, essentially. And we explored it, and she's been carrying this around she's in this new job, so maybe like 2 years, but all her life she'd had this sense of it. And she verbalized it just this morning, and we reframed it. We completely reframed it for her, and by the end of it she said, I'm really not a fraud, am I? I'm not, I'm not a fraudster. I'm really not, am I?
Thank
Really,
you.
you're really not. And so what do you want to do with that label now? And she said, well, I don't ever want to have that label attached to me again. And I said, well, whose choice is that? And she said, well, I suppose it's mine, isn't it? So, just moments like that where people have been carrying around baggage for months, years, lifetimes. And I don't think there's any other profession that helps people unearth it, but then move forward with it in the way that coaching does.
I mean, it can change everything for that person, where she had a certain perspective and she can have a completely different view now, and it can change every single aspect of her life. Something as simple as reframing something that she's been carrying with her whole life, and probably something that she didn't even choose to believe. Maybe it was a label or some conditioning. And yeah, it's so freeing if suddenly she realizes, oh my gosh, I'm not. It's actually not true. And there's a huge cost to me believing this. So that's beautiful. Thank you. So if someone's out there listening today, and I would like to specifically think about two groups. So the one is someone who is suffering themselves. So their health is not good. They're not in a good space. And also someone who's thinking about transitioning into working as a health coach, maybe creating that company, taking that step, quitting their job. So these two groups of people, if you maybe had something that you could say today you can leave our listeners with, what would that be?
Yeah. If I may, I'll start with the people that are thinking about becoming health
Sure.
coaches.
Yes.
I mean, if you've got the thought to do it, then that's come to you for a reason,
Yeah.
and you owe it to yourself to explore it. And, you know, it's not easy quitting a job. I had a mortgage to pay, I had bills to pay, I had, you know, a family to look after. So I quit reasonably gradually, actually, um, in that I sort of quit full-time paid employment, went part-time. So I kind of had a bit of a foot in both. Although for me, that didn't even last that long because I was so unwell that I had to just duck out of the world. But I think if I was to do it again, or someone else was asking me, I would say, it doesn't have to be a stark, I was employed yesterday and I'm not today, because that's quite frightening. So I think you need to work out a way where you can transition at your own pace. You know, some people want to just leave one and start another, and that works for them. Some people, more like me, perhaps would like that sort of slightly gentler transition. I think it's like anything in life, isn't it? It's the making the decision that's the hardest.
Yeah.
And we've all made decisions in life that have taken us ages to make, and we look back and we think that was the only decision to make. But at the time, we have to honor our you know, nervousness and our curiosity. So you won't regret it. You absolutely won't regret it. In fact, you'll regret not doing it, but you don't just know that yet. So trust yourself, trust the process, and know that if health coaching is coming to you as something you want to explore, then it's coming to you for a reason.
Yes, I love that. And then the other group, so if someone is unwell, listening out there, not sure what to do, what would your advice be for them?
Yeah. Yeah. Well, I mean, I'm really happy to talk to anybody genuinely. You know, when I was first unwell, I didn't really know anybody that had been through what I had. And thankfully, one of my friends did, and that person very, very kindly gave up their time to talk to me. And it really did make such a big difference. So I think, you know, my offer is genuinely, you know, if people want to get in touch, I would very, very happily and willingly, and it would be my privilege to give them some time. I think you need to think about what supports it is that you want. You know, is it counselling? Do you want to go back and unpick the past and, you know, really kind of understand the provenance of what's going on for you? Because that would be counselling, or that would be therapy. Or is it that you want to make sense of the past and understand it, but in order to be able to make use of it for the now and the future? And I think you have to sort of ask yourself, what is it that I want? And I think, you know, ask around, ask people that you trust. Do they know anyone that's been through anything similar? Can they recommend? I think if you're going to go for coaching, if you're somebody that's unwell, you're quite vulnerable, aren't you, if you're unwell? So you need to be looking for people that are qualified coaches that understand health, understand ill health. And there are lots of people that call themselves coaches and they're not. So just make sure that you find people that are going to serve you in the way that you absolutely deserve to be served.
Yes. So where can people find you if they do want to reach out?
Well, they can find me walking around the streets of North London with my dog, trying to control him. They can find me. They can find me on my website, which is atigocoaching.com. They can find me on the International Coaching Federation website. I'm on there too. I think the place I probably hang out the most is on LinkedIn. I've created a bit of a community on LinkedIn, and in fact, I've actually created an Atigo community. So I've got, as of today, I've got 312 people And we are just, I mean, I would say this, but I can, just an amazing bunch of people who have come together, who are wanting to make healthcare and people's health the best it can be. So if anybody wants to join that community, it's no cost, no commitment. I send out tips and techniques and tools, and I run various different no cost sessions and sips and tips, which is where we get together to have drinks and conversation. So yeah.
Fantastic. Thank you, Kristi. I really found it to be quite an inspiring conversation, and your genuineness and authenticness just shines through the screen. Even though we're very far apart from each other, I can really sense that authenticness and genuineness. So thank you so much for taking that time today, and thank you for sharing your own journey with us. And I think, of course, you are, but just you can be so proud, and we truly value that you've taken your own journey and took something from it in order to help others. And how many years later, and you're still at it, and you're still so passionate about it. So I think that your clients are really so lucky to have you. So thank you for taking this time out today, and all the best with everything and all the endeavors in future.
Thank you for having me.
If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.